As close to 1 million shelter in compacted South Gaza, shielding themselves from Israeli airstrike, disease and illness are already starting to infect the dense population that's facing rapidly deteriorating sanitary conditions. Doctors on the Strip say the lack of clean water and medicine, coupled with the massive overcrowding, has already started to cause severe intestinal infections and could soon lead to breakouts of cholera, typhoid, and respiratory viruses.
You have evacuation that is causing more overcrowding. You have very stretched healthcare system to the brink of collapse. You have blockade of food and clean water and diesel fuel that is needed to operate any hospital. And it doesn't take that long before we see more signs of outbreaks that's happening. Maybe a few days more, few weeks.
Shortages of clean water have led to wounds that cannot be treated due to the risk of infection, and Palestinians now have to face drinking water contaminated with bacteria or avoiding the water and becoming dehydrated. With Zahlul's team reporting that there is only one toilet for 10,000 people in Gaza, poor sanitary conditions will continue to add to the outbreak of infection. Gaza is home to 2 million people, half of which are children, according to the United Nations. Because of this, much of the population is highly vulnerable to illness. Palestinian officials reported that there were more than 3,000 epidemic diseases, mostly among children. These included, quote, diarrheal diseases, food poisoning, skin diseases, scabies, and bronchial infections, in addition to dozens of cases of chickenpox. Abud Okal, an American from Massachusetts, has been stuck in Gaza with his wife and 1-year-old baby since the war broke out. He says he's been staying in a small apartment with 40 other people and no clean water. Showers are a luxury we can no longer afford, he told the messenger through text messages. Quote, drinking water is extremely scarce, and we try our best to secure it for a day or two consumption. We have had to turn to unfiltered running water a few times, and even that is scarce. Zahlul warns that
any threatening infection or outbreak will lead to huge number of deaths because of the lack of capacity to take care of simple diseases. Simple viral infection could be life-threatening to newborn. Also, if you are older patient with COPD or chronic lung disease, or sometimes simple viral infections can also cause death. If you have a child who's immunocompromised or have low weight and they have diarrhea, that can also cause death.
Israel's complete siege of Gaza following the October 7th Hamas attack has created a multitude of life-threatening issues for Palestinians. Supplies of food, fuel, water, and electricity have been cut off, with limited humanitarian aid coming into the Strip. And according to Palestinian officials, more than 7,000 have been killed. People in Gaza are fighting for their life on various fronts, Zahlul said, adding that there is little reporting being done on deaths due to health conditions.
I think the most important thing that we have to understand the gravity of the situation, these people who are dying in the dark in their houses, in crowded places, and no one knows about them, the elderly patients who have heart disease or diabetes, who are having now difficulty finding their medications, patients who died of heart attack. Although this is related to the war itself, people do not connect the dots.
I'm Safiya Sami Ali, reporting for The Messenger.